Hello, I am Dr. Banarji, Senior Consultant Orthopedic. I am Shoulder Specialist at Sakra World Hospital. Diabetes mellitus can impact on multiple organs in the body. A chronic diabetics will have multiple organs being affected. Similarly, the musculoskeletal system also gets affected due to chronic diabetes. So it can affect the bones, joints, nerves, ligaments, tendons, and etc. A shoulder joint is one of such organ in the musculoskeletal system which gets affected due to chronic diabetes. There are various implications due to diabetes which can reflect in the shoulder joint. The commonest being the frozen shoulder, which happens most commonly among the diabetics. The frozen shoulder is a condition which is seen most commonly among the diabetics due to poorly controlled diabetes, or it's also associated with chronicity of the diabetes mellitus. So there are a lot of changes which happens at the cellular level and also at the collagen level, and the shoulder joint becomes stiff and the capsule of the shoulder joint which becomes fibrosed, thick, and it loses its mobility and it becomes painful and inflamed. So what happens here is the shoulder joint, which is extremely mobile and free, becomes stiff and painful, and patient will lose the mobility and they have painful joint. So this is one such condition. Other conditions are the inflammation of the tendons or tendinitis, or inflammation of the lubricating layer of the bursa, which is called a bursitis, and also the early degenerations of the tendons. The tendinitis can progress into degeneration of the tendons, and the chronic diabetics can have early rupture of the tendons, or the atraumatic or less trauma related rotator cuff tears are also reported commonly among the diabetics. So other condition which can affect in the shoulder joint due to diabetics is the entrapment neuropathy around the shoulder joint. So there are several entrapment neuropathies which can happen surrounding the shoulder joint. Commonly the suprascapular nerve entrapment, which can affect the shoulder joint, and there can be a weakness of the rotator cuff muscles, and secondarily there can be pain. So this condition leads to pain and weakness of the shoulder joint, which can mimic like a frozen shoulder, but needs to be evaluated properly clinically and with diagnostic tools, and needs to be managed. So management or treatment of the diabetic shoulder needs to be thoroughly evaluated clinically and also with diagnostic tools, and it has to be managed thoroughly in terms of proper diabetic control, physical therapy, and also proper treatment in terms of orthopedic intervention. If there is a tear, it needs to be repaired, or if there is mechanical issues like an thick and inflamed bursa, that needs to be excised, and if there is a resistant or recurrent frozen shoulder which is not amenable to physical therapy, that needs to be released. Now, there are various treatment modalities. It all depends upon the individual patient and individual condition, and it has to be individualized according to the patient needs. So diabetic shoulder is a condition which has to be thoroughly evaluated by the treating doctor.